I didn't even realise that nurses worked in prisons. I hadn't really thought about it before.
So primary health care in a correctional centre looks a bit like A to Z of nursing. So we do a little bit of everything. We look after wounds, we look after infections, immunisations, we look after emergency responses, drug and alcohol assessments, primary health assessments for people coming into custody. So you might get anything from a toothache to like a spider bite to a stab wound. I think apart from having cells associated with our clinic, it's not unlike a hospital environment in the clinical setting. They are really nice places to be.
So a lot of people don't really realise that it's more like a GP clinic than anything else.
We do have a lot of chronic disease, people with chronic diseases which we manage, but it's general everyday things that you would go and see your GP or the chemist for that our patients come to us for.
Well, you tend to be a bit more autonomous than what you would be in any other health setting. Yeah, you're given the opportunity to make more decisions. You wouldn't get that working in any other health setting that I've worked in personally.
So we work with a team of approximately 5 to 7 nurses a day. In primary health, we do clinical work, but also the more monotonous chores of nursing, which like medication and methadone and all the things that our patients need. So on an average day, you have so much autonomy over how your day runs. You choose your list, you choose what patients are coming up.
While we work all together as a team, you are expected to perform on your own at certain times. When things go beyond what you're comfortable doing, there's always people around you to help. Always people with more experience in a certain situation than you.
I found coming from the hospital to Justice Health, I was often required to use skills that I rarely used in the hospital and to develop new ones as well. I've never worked in an area where I've been as encouraged to develop my career as Justice Health. The training opportunities are amazing.
So I've been working with Justice Health for around 5 years now. What good thing about Justice Health is you get a wide range of opportunities.
We work really hard for the patients and we're all driven by the same goals.
You're not going to find such a varied amount of people in one place coming from all different walks of life and just wonderful, wonderful people to work with. Best I've had in 20 years of nursing.
So a common misconception I think of people that don't work in a prison is that we're constantly involved in really scary situations, but it's not actually true. I feel very safe in the jail, probably more safe than in an emergency department. Corrective services do such a great job of keeping us safe, and I think oftentimes our patients, they haven't been looked after and they do have health needs, and when they feel like someone's actually trying to help them often, it really does mean a lot to them. So what I found is you don't actually have to be really tough or really, really, really assertive or aggressive to work in a prison. You can be trustworthy and you can be kind, and that's actually a good fit for a nurse in a prison, I think.
The clinical skills that you'll gain from working in an environment like this are second to none. The interpersonal skills that you'll gain from working with the clientele that we work with is second to none. And I just think the experience is so rewarding.